Well, if you are on a Medicare supplement or you're thinking about getting into a Medicare supplement, this is going to be the video for you. We're going to do a little nutshell overview of how it works with original Medicare because that's the only way it works is if you have original Medicare. But then also there's a couple of letters floating around, G and N, that are going to be the most popular, and we're going to go over the similarities and the differences in these plans. Let's get into it. Now, as always, I do like to work from Medicare.gov. It's how I learned Medicare and all the plans and parts, but then also it's something that you can access and look at and maybe even follow along. So I'll go ahead and share my screen. Now, I went to Medicare.gov, clicked on learn more about Medigap. See, on Medicare.gov, they call it a Medigap. Now, well, let's just kind of rewind. The reason why they call it a Medigap is because it fills the gaps of original Medicare. So if you have, why don't you just bust out a pen and paper? And if you're listening to me, imagine that you have two blocks, one on top of the other. And that first block is going to be your primary coverage. Primary coverage being original Medicare, also known as traditional Medicare. This is Part A and Part B of Medicare. A being the hospital, just think overnight stays. You get admitted into a hospital setting, an inpatient hospital stay. This is going to fall under Part A of Medicare. Underneath that, you've got Part B of Medicare, which is outpatient. So think you go to your primary care, you go to your specialist, you get lab work, you go get an X-ray, MRI. Um, Also covers things like infusions. So maybe undergoing chemotherapy, maybe you're treating rheumatoid arthritis and you're going to see your rheumatologist and they do an infusion. That is going to fall under Part B, those kinds of medications that are given in the setting of an outpatient setting, that falls under Part B. And you may be thinking, well, that kind of sounds like insurance. Well, it kind of is. Don't forget your drug plan at the very end. You got to add one, but that's another video. Now, it barely counts. So, what I like to say is it barely counts as insurance because it's got a really high deductible on the hospital side, 16 something. I'm not going to get into it. It's on Medicare.gov. It's too high for my liking. Okay. It'd be too high for my mama and my daddy. So they have plans to back up original Medicare. So again, Part A has a high deductible. Let's just call it 1630. And every time, I say every time you're admitted because this thing restarts every 60 days. And if you go past 60 days, it moves to a daily copay after that. It's just not a scenario that you would put yourself in before 65 or even after 65. So you've got that high deductible on Part A. And then on the Part B side, not bad. You've got a 250 in 2025, $257 annual deductible to hit. You'll probably knock that out in a couple of doctor's appointments. Here's what you can't knock out is it doesn't have a cap. It doesn't necessarily have a max out of pocket. So if you look at your current insurance card, this is if you're not on a Medicare supplement, maybe you're aging into Medicare and watching this. You've got group insurance, maybe you've got Obamacare, Marketplace, and on that card it'll say in network OOP or MOOP or OOPM, out of pocket max. This is going to be okay. Joe, if you get your head transplanted and all your limbs replaced, the most you're going to spend in a year for medical services, all the copays and deductibles adding up, copays adding up, it won't go over that number that's right beside it on your card, which is usually five, six, seven, $8,000 with some plans. Part B of Medicare doesn't have that cap, and that's exposure number 2 that we want to cover. So going back to those blocks, that I told you to write down. So that first block is your, go ahead and mark down primary coverage, original Medicare Part A and Part B. Your secondary coverage, we're on to the next block, is going to be your Medicare Supplement plan, or also known as a Medigap plan. Why? Because those gaps in the first box are going to be covered by this Medicare Supplement plan. And you've got really two options that are worth it. A plan G is in go or N is in Nancy. G is going to, let's talk about G first. Well, let's talk about the similarities of G and N first. Both G and N do not cover the annual $257 Part B deductible. So that's up to you. That's your skin. After you knock that out, here's where they differ. A plan G covers 100% of everything after that. As long as that primary coverage, it's a covered Medicare approved service. As long as that first primary coverage covers their portion, your plan G will pick up the rest. Very simple. It's about $30 more than a plan N. Why do you ask? That is because here's the difference between N. Not only that it's $30 more than a plan N, but a plan N has three differences after that. First one is going to be a doctor's copay. This will be a copay of $20. Could be a little bit less, could be nothing, but it won't be more over $20. Doesn't matter primary, doesn't matter secondary, $20. Okay. Number two is if you end up in the emergency room. So you're chopping carrots, boom, you chop your finger, you got to go to the ER to get stitches, you walk out, that'll be $50, 50. Again, could be less, probably won't, but it won't be more. And the third difference in these plans is a plan N does not cover excess charges. Now you may be thinking, whoa, 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 well, I don't want excess charges. I don't want to be left with that exposure. So why would I go with plan N? Statistically speaking, this happens about 4% of the time. Why? Because most of the doctors in America accept Medicare's price list. They abide by the rule. They cannot charge, over this line item amount for a hip replacement or whatever it is. Now, there are some doctors that say, no, 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 I want to charge in excess. They can go up to 15% in excess of that charge. Plan N does not cover that. Now, if you are a person that just wants the top dog plan, wants this to be as black and white as possible, doesn't want any gray areas, doesn't even want to mess with, taking out $20 at the doctor's office, then get a plan G. It's okay. But if you're looking for a budget-friendly option that keeps you in the Medicare supplement realm of things, so, no network, very little prior authorizations, if any, and you don't have to wrestle with the insurance company if you and doctor feel like that you and doctor say, for my shoulder, I think the best route is going to be to, get a scope done and shave out all of my labrum. I've got tons of, build up from playing back in the day or whatever it is. My point is you're going to get that because it's a Medicare approved service. So if you still want to be in the realm of a Medicare supplement, but you need a budget friendly option, I think a plan N is a great, I don't know what this statistic is about getting struck by lightning, but basically this is what I say. You're more likely to get struck by lightning than that chance of an excess charge to come your way. And it just depends on how you make decisions. Do you make decisions? I personally make decisions based on statistics, based on numbers, based on calculations. And for me, 4% of the time, I'll take that risk. I'm going with a plan N. And that's for me, because for me, I don't, well, number one, I'm not 65, but I don't really go to the doctor. And most 65-year-olds I meet don't really go to the doctor either. You may be thinking, well, what if I do? What happens? And maybe I should go with the plan G. wait a minute. I just told you there's just those two scenarios that are different than a plan G. If you get struck by lightning and you end up in the hospital, an N will cover you exact same way as a G would. All right, now let's get back to Medicare.gov. Here's what I wanted to point out is this line here. And I'll read it out just in case it's way too small on the screen. All Medigap policies are standardized. This means policies with the same letter offer the same basic benefits, no matter where you live or which insurance company you buy the policy from. Hold on now. Let's let's put it now in layman's terms. Let's grab it off of Medicare.gov and let's break this down. Say it with me. The coverage follows the letter, not the company. So please don't, go flash your insurance card around and say, "Well, I've got a Mutual of Omaha Plan G, and mine's the best." Well, sorry to burst your bubble, but a United Healthcare Plan G, a Humana Plan G, a Cigna Plan G, a Woodman of the Life Insurance Company Plan G, a SBLI Plan G, you name it. Heinz 57 Plan G is going to cover the same way your Mutual of Omaha Plan G covers you. So now, why do I say this? Why do I bring this up? Well, I'm glad you asked. Is because each one of these companies, hey, they manage their financial books a little bit different than the other one, which means, whoa. These our little clients here in this little pool of people. Yeah, they all have Plan Gs, but geez, they're getting sick. And I'm looking at my checkbook, and I'm not sure I can pay all these claims. We better raise rates. Ding, ding, ding. So annual rate increases will determine, um, well, they'll determine your decision to either shop around or not. Here's the thing about shopping around is number one, you don't have to wait until annual enrollment period to shop for your Medicare supplement. This is a big misconception. You could pretty much shop every month if you wanted to. Okay, so when you get your next statement, you get your and this is great advice for those of you who aren't on a Medicare supplement, maybe thinking about it, maybe started with a Medicare Advantage, now you want to go to a Medicare supplement. Now, in that particular case, yes, unless there's some kind of special enrollment period, you will have to wait until annual enrollment period to do this. But other things set aside, if you get your statement, you're looking at your plan G and say, dang, this sucker went up another $15. It's already went up, and maybe you've had this supplement for 5 years. I call this sup management. I really don't. I just made that up. But you must actually open the mail that your insurance company sends you because, hey, there might be an annual rate increase in there that just happened. I think Blue Cross Blue Shield had a pretty steep one recently here in Texas, like $25. I got some phone calls. We did some shopping around. Here's the thing about it though. You want to do it as early and as fast as possible. Catch it when you can and while you're still healthy. Not saying everybody's going to get unhealthy, but you know, happens. Okay, no one. If I could say, hey, look here, Ron Smith, you are going to. Looks like you're going to experience a heart attack pretty soon. You probably won't qualify for another jump to another Medicare supplement to go rate shopping like we always do. Let's go ahead and do that now. I can't do it. No one has a crystal ball to say when you should jump from another supplement to another. And by the way, most of the shopping around that I do is for the same plan. It's just going to another company for another plan G rate because that company has a less of a premium than maybe the current company. Now, that's also why you want to pick a Medicare supplement from a company that's reputable, financially fit, maybe has been in the Medicare market a whole lot, so they've got experience how to navigate these rate increases. But ultimately, it's that plus the market and inflation. So the point is to always open your mail. The next point is that yes, there are some differences between G and N, and if they resonate with you, you should contact your broker, or by all means, click the link below, and I'll be happy to work with you on that. And point number three is to actually just be a little bit more involved, a little bit more proactive in your Medicare supplement management, because it could mean saving some money annually that goes in your pocket or goes to your next R&D trip or your next Cancun trip or goes to the grandkids, Christmas present, what have you. That's my point. So I hope you like this today. Medicare supplement plans are my absolute favorite because they're the most hands off to manage as an agent. And at the end of the day, I can't say it provides you the best coverage, but it sure does provide comprehensive coverage when compared to other plans. So have a great day, and I'll see you in the next video.